Do I need to do Pilates or do I need to do yoga? Well, it actually doesn't really matter because some people are stiffies.
Yep.
I'm a stiffie.
I'm a stiffie.
I can barely touch my toes. Sounds dreadful. And some people are floppies. You like that? I learnt this from a physio many years ago. And some people are floppies with stiff bits and other people are stiffies with floppy bits.
This is great. Hi, I'm Anna Liptak and I've been a fitness trainer now for over 15 years. Over this time, I've been privy to witness so many ordinary people achieve so many wonderful things. Through this podcast and a documentary I co-produced, I'm Not a Runner, I want to share these stories to show everyone that anything is possible if you have the belief and the motivation. So this morning, I'm really pleased and excited to have Rebecca Sabine from Vital Core Physiotherapy with me today. And thank you for your time, Beck, because it's the bane of my life is injuries and people dealing with injuries and starting to exercise. So thank you for being here today.
I'm very excited to be here. It's going to be good.
Yeah, thank you. So I'd like to just start with really, if you can just give a bit of background about who you are and what you do.
Yeah, so I'm a physio, obviously, and been a physio for about 20 plus years now, just over. Also a mother of 3 kids, active kids, and I'm also a runner. And I've managed to combine all of that to become a physio of runners and particularly of mums who want to run. I really love helping all women run, keep running or start running. I'm also a pelvic floor physio, a women's health physio, so I really like to incorporate all the things that can be related to the pelvic floor or women's hormones with running and help women out that way too. I have a clinic, as you said, Vital Core Physio, which is in St Maurice, which is in the eastern suburbs, and we've been there for 18 years, myself and business partner Tori Toogood. And we've really built up the clinic as just a community-based physio, but then also with a lot of emphasis on women's health.
Fantastic. And we actually met on course on the Great Wall of China, I think it was.
Yes, of all places, a bit exotic. Yep, so that was back in, I think, 2012.
2012,
I think. Yeah. And that was an exciting run.
Very exciting, very hot,
very
hard,
hot, very humid, yes.
Run and tested everything that
absolutely,
I had, mentally and physically.
Yes, agreed.
So I guess to start with, Beck, there's so many questions.
Yep.
I have an online beginners marathon training course, which takes people from WOA to a marathon in 12 months.
Fantastic.
I also have an outdoor fitness program, His and Her Time, which takes, beginners really to start exercising. So a lot of those people have started with me after not exercising for 20 years. And that's just not women as well, that's also men. I got it changed to His and Her Time after about 4 years because the men got jealous and wanted a part of what was happening to the women. So my focus in there is to build strength and actually build confidence for these people and empower them. But I find that a lot of people come into training with me, whether it be on the online program or His and Her Time, and they remember 20 years ago that they could run and they could run a kilometre or they could run 2Ks or they can sprint. So a lot of people will come out and do the sprints and it's like, no, don't do the sprints because you've got to be attuned to that. With all of what I'm just talking about, I guess, what are the first sort of injuries that people can do when they go back to exercising?
Yeah, that's a really common presentation. People who used to exercise or they haven't exercised for a while and then they get back into it. The biggest thing we see, without a doubt, male, female, young, old, is just doing too much, too soon or too hard. And so we're talking about these things called loads. And they think that they used to be able to run 5 kilometres, so that's what they should be doing. And as a result, they push too hard too soon and they end up with some sort of injury. Now, that could be anything, anywhere, but with runners, we tend to see some pretty common places of the hips, particularly for women, so hip pain, but also knees, the front of the knees, and then somewhere in the foot and ankle, so Achilles soreness or something called plantar fascia soreness.
Yes.
So they're the really common sites, and that's really because the tendons, the tissue in those areas just hasn't been conditioned for it. So a very, very common condition, tendinopathies, is a very, very common condition, and we'll see it in our beginner runners a lot.
Yes, and they present to me with that. And so what's the best way you can avoid that? In our online program, for instance, we start with walking. If people haven't been jogging, they'd start with walk, and we try and build the routine first of all. So just build that routine. What else can they do? Like what can people to avoid these injuries? And I'm particularly interested in the hip.
Yes,
as well.
Well, it's absolutely, I absolutely agree. Building just those habits of exercise. So perhaps with their, say, marathon program, they may want to eventually be able to run 3 or 4 times a week, but you can't do that if you can't walk, right? And if you can't walk comfortably, half an hour to an hour, 3 or 4 times a week, then you really can't run it either.
Yeah.
So one of the things is, I'd agree, just building up some of that real baseline habits and low-grade cardiovascular fitness. So walking, absolutely. But we also want to make sure that we're strong enough for running.
Yes.
So a lot of, if I guess focus a little bit more on the women for a moment, is that they may have had a baby a couple of years ago, and they've decided to go back to their running. And their body shape and, I guess, composition has changed quite a bit. And they may not have quite the same muscular bulk that they did have around their glutes and around their hip muscles. So working on the strength of their hips, their gluteal muscles is critical for running. But then not just the hip muscles, the calf muscles are another critical one. So when we walk, we use a slightly different muscle to when we run, and we need to condition both of them for running. So really strengthening the calf muscles is really, really important as well. But then there's plenty of other factors as well that we need to strengthen. So I guess the key word is strength. So we have to be strong enough to run.
Yes.
So that's one of the other factors. Another key factor is, learning how to run again.
Yes. Can I just move back to that strength first before we move on to the learning how to run, but the strength. So what do you recommend to people to get strong? I mean, obviously, I run his and her time outdoor fitness, and I do strength training, and we do a lot of leg strength. But say for someone that's doing an online program and they're just doing, and we're trying to reiterate that, the strength training is really important. What could they do at home on a daily basis?
Well, certainly if we can look at, I guess, somewhat even from the very beginning, programming in their week. So they've got a couple of good strength sessions a week, and that may only be half an hour, but we want to get gluteal strength.
Yes.
We want to get calf strength. We want some form of core strength, but we can come back to that later on. So our glute strength can be easily achieved through squats. And people go, I don't know how to squat. Everybody gets up and down off a chair 1,000 times. Say, for example, so if you come on up, Anna, and if instead of just dropping into a chair or slumping into a chair like we often do, so just drop down, right? If instead you come back up again, you go down slowly by sticking your bottom backwards, putting the weight into your heels, lowering, keep the weight in your heels, keep your weight in your heels, down, don't drop, and then come back up again in the same fashion. Suddenly,
so it's just down.
Suddenly, and then you're doing squats.
Yeah.
Now, if you think about how many times you do that through the day anyway, all of us, even particularly office workers, then suddenly you've got who knows how many squats a day. Or you could say, actually, in the morning when I go to my office after my tea break, I'm going to do 10 of these sit to stands, and suddenly we've got a set.
Yes, and that's exactly what I say to people, because that's one of the most important. I mean, it's one of our biggest muscles, isn't it, is our quads.
Our quads and our glutes, and they're critical.
Yeah, and so, I say to everyone, you should be telling your parents to do that, because that's what I've heard is the biggest reason why people go into nursing homes, because they can no longer sit on the toilet and they can no longer get in and out of cars.
They can't get out of that's right, they can't get out of their chair, they can't get out of their bed properly, and it's their leg strength. So that's number one. Glutes and quads, and it's easily done with sit to stand.
Yes, and just going back to what you said, you don't need much time, do you?
No.
You could do that, like you said, a set in the morning, and you could do a set in the evening, and at least you're doing 20 more,
Absolutely.
And over time that adds up, right?
Absolutely.
Yeah.
Another thing we really want to try and get is, so if you've got your leg strength, we also need you to have this single leg strength. And that's something we don't do enough of, is standing on one leg.
Yes.
But again, it's easy to achieve. So come on up.
Yep.
So, okay, we'll go back to the work analogy. It's morning tea, and you've gone into the kitchen at work and you're making a cup of tea. So the kettle's on. So your aim while the kettle's boiling is to try and stand on one leg. Now, as you stand on one leg, you're not going to wobble. You're going to be strong through the grounded leg. You're not going to put all your weight onto your toes.
Mm-hmm.
You're going to keep your pelvis nice and level, and you're going to hold it. Now, you could just do that one leg for the entire kettle boiling, or you could do it in little blocks of 10 seconds.
Yep.
Okay, and suddenly you're working on that strength, and you might notice the more you do it that one side is easier or harder than the other. And so that side that's a bit harder, that's the side you want to work on.
Yep. And that's just it's a beautiful little exercise because you realise how many tendons and ligaments you've got in there that you're holding. And I try and do that with the people that I train. If they've got an injury, I say just stand on one foot.
Just stand on one foot.
And if they can do it, then we close their eyes and all of a sudden you can't. But it's a great exercise,
it's a really simple one, and it's a great one for the beginner runner because, you'll be surprised at how wobbly you are on one side more than the other.
Particularly if you have caffeine, I find.
Yeah.
That's great. So that's a really easy and nice way to build up that strength.
So 2 really simple ways that you can get that done any old time.
Yes.
Yeah.
And like you said, doing a cup of tea or waiting for somebody or, standing at a bus stop. But I think that why we don't do these is that they're so simple we don't do them.
Yeah.
But they're so simple, if we did them over time, the strength will be amazing.
That's right. It would just compound and we would get stronger.
Yeah.
And for our ladies, our female runners, the pelvic floor strength is also critical. So if they know how to do a pelvic floor squeeze, they could be doing a squeeze with the squat that we demonstrated or with the single leg stance.
So can you explain to someone, can you verbally explain how you do the squeeze?
1 in 3 women will do it wrong. So we need to be a little bit careful with our wording.
Yeah.
If you think about the muscles inside your pelvis that you squeeze to stop a wee, or the muscles inside your pelvis that you squeeze to stop wind, fart, coming out. That's your pelvic floor. Now, you want to be able to squeeze those muscles without your tummy coming on or your legs squeezing or holding your breath. So if you can activate those muscles and you can feel something on the inside coming on, you may have a pelvic floor squeeze.
Right.
If you go, I've got no idea, then you come and see me.
Yes.
Yeah, I can help you with that.
Yeah. So tell us about, as a physio, what you, I do train a number of women that do have problems with their core. What is the process of working with someone? How long does it actually take?
So we'll see women who have, we call it a pelvic floor dysfunction. So something's not quite working right. Problem with incontinence, so leaking. It might be wee, it might be poo, it might be wind, or feelings of heaviness in the pelvis, or even pain. And so if a woman comes to see us for that problem, then we will talk to them about it and what they want to be able to do and what they're experiencing. And we'll ask lots of questions about their pelvic health.
Yes.
And then if they're okay with it, we'll do an examination. And that may be a pelvic floor examination, so a vaginal examination, or it could just be using the ultrasound machine too to determine what's going on.
Yes.
And then from there, we design a program, whether it be a strengthening program or in some cases a pelvic floor relaxation program. Interestingly, though, we do see a lot of pelvic floor problems in runners. And you might go, oh, yes, it's the jumping and so forth, that, maybe they're leaking. We see a lot of pain, pelvic pain in women in particular, but also men with running because there's a tendency for some women and men to tense through their pelvis.
Right.
That can become quite uncomfortable. So we do a lot of pelvic floor relaxation.
Yes.
But also, if you are not super strong through your hips or your tummy, or your legs, you might try to compensate somewhere else, and that may be the pelvic floor. So again, being strong in other areas of your body can actually help your pelvic floor.
Right.
It's not the be-all to end-all. The pelvic floor work is really important.
Yes.
But making sure everything else is working well is as important.
Yeah. That's a really big one because it sometimes prohibits people from exercising because they're so embarrassed.
And they're so embarrassed. And
it's awful, right?
That's right. And so we really want to encourage people to talk about it. It's just like having a hamstring injury with running. If you had a hamstring strain and you go, oh, my hammy hurts when I run, you'd have no problems telling your friend, your trainer, your running partner. I'm wetting myself every time I run downhill. We tend not to be so comfortable with mentioning that. No. And it's just another problem that we can treat.
Yeah, so that's great to know a core specialist too, because there's, there's only a handful of you, I'd say, out there.
There's more and more, which is fabulous. Yeah, which is good.
Yeah, that's great. So going back to the injuries, injuries that present themselves to me as well is another big one, and I know this is from overdoing it too quickly, probably too big, but it's the ITB.
Yeah.
And that can prohibit people, eventually if that gets too bad.
Yeah.
Why does that come, and how can you prevent that?
Well, it comes back to our glutes again, Anna.
Right. Yes, it's always the glutes.
Always the glutes. It's always there's other things too.
Yes.
So it's we call it the whole chain. So it's the whole lower limb chain, from the lower back, the glutes, the hamstrings, the calf, the foot.
Yep.
Somewhere one of those links of the chain is not working that well, or maybe a couple of levels.
Yes.
Particularly with the ITB. The ITB is this fascial band along this part of your leg that in theory it doesn't have any contractile component, right? It doesn't actually contract and relax like muscle does, but it's designed to give you some tension. So if you aren't getting enough tension through this side, the outer part of your leg, which should be coming from your glutes in particular, or your hamstring, but more your glutes, then the ITB will start to get tight.
Yes.
The ITB comes up and joins up with a muscle up here. It's called the TFL. It's all you need to know for now.
The hip for the layman.
The front hip part.
Yeah.
It tends to work too much, which also tends to trigger the ITB, again, when the butt's not working. So we need to get those glutes strong.
Yes.
And really strong and really capable.
Because what eventually ends up happening, what I see, is that the knee then starts...
Yeah, the knee, So then the ITB...
pulling.
Yeah, inserts into the side of the knee. You get very, very angry and sore through the outer part of the knee, and then you start to develop other compensations as well. So it's not just the glutes, it is other parts, but that's particularly it's a huge component of it.
So, what I see, people present with very low, pain, and they do stretching, the stretching, and then there's people where it actually just prevents you from running for some time. So if someone presents with just the low grade, what's the best thing to do for that stretching?
So the ITB itself doesn't stretch very well. So the foam rolling is worthwhile, but what you'll often find with the foam rolling is
it hurts.
It hurts like crazy, yes. The ITB will be incredibly sensitive.
Yes.
If you come just slightly to the front, you'll roll the outer quadricep muscle, and you'll find that that's also very, very sore, but you'll get a much better response from your foam rolling if you roll that section than you will on the ITB. The ITB will end up bruised.
Yes.
This area will end up probably a little bit bruised, but it's got a beautiful blood supply and it tends to respond nicely too, so it'll tend to calm down a little bit.
Yeah.
If you are rolling, just be mindful you don't want to roll over the bony bits.
Yes.
That really hurts.
That does hurt.
It's hard enough as it is.
And I guess, like for me, with people that present to me, I say, go and get it checked by a physio. I mean, that's the first and foremost thing someone should do to prevent the longer term injury.
Yeah.
But these are sort of little steps that people can do and
they're
for
all
themselves.
symptom managers.
Yeah.
Yep.
Which is great for you to share that with us. The other one that I see, Beck, that's presented quite a lot, and I believe it's an older person's injury, which is the attachment of the hamstring.
Yeah.
And it's an awful one because it can last for ages. And I had it. But where I think I got it from is that I went to a yoga class, and I'm quite competitive. So I overstretched, and I've learned a lesson there that it was overstretching. And I need to strengthen my hamstring rather than overstretch it. So there's a really fine balance in there.
Yeah.
Can you tell us about that one?
Well, I guess it's absolutely that stretching. Do I need to do Pilates or do I need to do yoga? Well, it actually doesn't really matter because some people are stiffies.
Yep.
I'm a stiffie.
I'm a stiffie.
I can barely touch my toes. Sounds dreadful. And some people are floppies. You like that? I learnt this from a physio many years ago. And some people are floppies with stiff bits, and other people are stiffies with floppy bits.
This is great.
Anyway, so what I'm trying to say is it's very individualised. You need a level of strength, and you also need a level of mobility. And I think probably changing the word from flexibility to mobility, it might be another way of looking at it, and going, actually, if you are, say, seemingly tight in your hamstrings, is it because your hamstrings are working too hard? And if they're working too hard, what muscle's not working enough?
Yes.
So look at that from that point of view. And is it your hamstrings tight, or is it somewhere else up the chain that's got quite restricted and all the strain's going on the hamstring? So quite often, and we'll see this with our gentlemen who are perhaps over the age of 30 and maybe those pushing 60, is that their trunk, their spine gets very, very stiff.
Yes.
So particularly their lower back.
Yes.
And a lot of them will lose the ability to touch their toes. And they go, oh, my hamstrings are really tight. But when we do a proper hamstring length test, so laying on their back and bringing their legs up, the hamstrings aren't that bad. So what's going on? And it's that they've lost some of the mobility through their lower back. And then, the hamstrings have to do a lot more work. It's just the way it is. So working on your mobility, not just with your hamstrings, but through your lower back, through your calf, even through your foot, can offset some of these tendons.
Mm-hmm.
Those hamstring tendinopathies are nasty because every time you sit down, you're putting pressure on it.
Yeah, I found that even when I was driving long distances, I was just like, oh. But it's dissipated now, but it flares up occasionally still. And a lot of people I train deal with the same problem.
Yep.
I do, from my own experience, know that they just need to strengthen rather than overstretch.
Yes, and it's also that whole strengthen. And a lot of people say, oh, you need to strengthen your glutes. Well, yeah, you do, but you've got to strengthen the tendon. So the big thing about the tendon strengthening is you have to, so there's a term saying, load is the cause and the cure of almost all injuries, right? So too much load and you injure the tendon, the hamstring tendon, and in this case it was too much pulling on it, stretching. Yeah. But you need to apply a similar load to it, just enough to make the tendon toughen up again. Yes. And what tends to happen often with runners is that they hurt their hamstring for whatever reason, and they do all their squats and their single leg squats and their deadlifts, and then they go and run, but they haven't quite strengthened the actual hamstring tendon. And so it's being very specific with your rehab as well.
So do you have? I learnt quite a good exercise that I thought. Yeah. Do you have a good exercise for that tendon?
I'd love to know yours first.
Okay. Well, what I was given, and I give this to people, and people can either start with the wall, and it was coming down sort of into that lunge position and then pulling that leg up. So working through that tendon there, and just really strengthening it, and then coming to no hands. And strengthening, but nice and slow. So it was really slow, and then holding that up through this.
And so that's a really nice, and we'll call that a complex movement, in that the glutes and the hamstrings are working really nicely together. Yeah. It's also functional. It's very similar to running in itself. Yes. So that's quite a nice one. The other one is going in a more of a straight leg format, so a single leg deadlift or a arabesque. So if you come up again.
Arabesque, now we're getting into ballet.
I know. I like to call it arabesque because it sounds so fancy.
I'm not a ballet dancer.
And it sounds very graceful until runners demonstrate it. So, so standing on one leg, and then if we've got enough room here, trying to keep that left leg you've got at the moment straight, okay?
Like that way.
And that's it. And then you're tipping your entire trunk and trying to keep your hip and your leg. So normally, can I stand it all here, Rory? This back leg would lift up a bit, but you can.
Am I going to hit something?
Come back up. And then the whole lot comes back together. So if you go one more time, your trunk and your grounded leg stay as one. So don't lean forwards. You're trying to keep your spine nice and neutral. So imagine those beautiful ballerinas. That's it. So suddenly you've got, your
leg going at the
leg
same
is working crazy. Your hamstrings working hard. Yep. Your trunk's working hard. Your hip controllers are working hard. Yep. Just to there, and then you'd bring it back, and then you could bring that front knee up in front. Yeah.
Yeah. Okay.
And so as you pull yourself back up, it's a lot of hamstrings.
That's nice.
Yeah, and you could do that with weights and so forth too. Yeah, it's really good to do with a mirror and absolutely holding on initially.
Yes. That's good. Yeah. Okay.
And there's lots of different ones, but I guess the important part is that once you have an injury, you need to rehab the actual injury. So you've got to work that hamstring tendon in that case, and as that became easier, what's really important is that we then progress it and make it harder and harder, so that tendon's really tough, because running, there's a lot of forces that go through tendons with running, so in the lower body. So you have to be really quite tough to be able to run a marathon.
Yeah, and that was an interesting point. I I was listening to you speak the other night too, Beck, but, I do tell people, you are really, 3 times your body weight going through your knees and things, and my brother being a surgeon as well, he's like, most people probably don't need surgery, they just need to lose weight.
Yeah.
And, I'm really careful with that as a trainer because people, I believe, need to be happy with their bodies and celebrate their bodies and not be all about weight loss. So there's a very fine line in there, but we also have to be healthy. And if we want to run long distances, it's of course going to be a lot easier on our body and preserve our tendons and joints as well. So
absolutely. And and again, as a physio, and a women's health physio, I'm very careful with my words around body image as much as possible. And certainly because I help a lot of mums, and mums who perhaps, not always, but perhaps are a little bit conflicted with their body image at the moment. Yeah. But it's about strength.
And as you and I both know, running so many races, and I've been at, the front, the back, all sorts of types of there's all different shapes and sizes, but the one common theme of the people up the front, and they're not necessarily skinny, they are strong. Yeah. So there's some big girls out there and big boys out there, but they are strong, and their legs are strong and their cores are strong. Absolutely. But they're not necessarily skinny.
Absolutely.
And, and they're fast.
And that's right, and that gives them longevity too. Yeah. And without it, without it, you just, you won't enjoy it as much without that strength. It's just hard all the time.
Yes, and that's why I started the his and her time. It was to really get people to, enjoy their bodies through their strength. Yeah. And I think once you start getting that strength, then the running actually does become easier. Yeah. And you don't get as many injuries. Yeah. So, I really want to put that through because people, know that I love getting beginners to the finishing line. I love it. But one thing that they do have to understand is that strength is actually the one that's actually going to pull them through. And if they come up with any of these sort of injuries, flare-ups, go straight to physio because and miss the training sessions that are written in the plan. Yep. Go to the physio, get it fixed, take the 2 weeks off and get back on. Yep. Otherwise, you're going to be keeping on going. The other thing, we talked about before, because you and I are both runners, that, when you're following a plan, it's really hard to stop the plan when you know that someone else is still continuing.
Training for an event with a group is fantastic. It gives you accountability. It's so motivating. However, if you're starting to fall behind for whatever reason, then it's really important to go, actually, I need to adjust it. Yeah. Again, when we talk about these loads that cause injuries, these loads aren't just doing too much, too hard, too soon. It might be some internal loads, like you're too tired, you've been running the kids around, you've been working 50-hour weeks, and your body's actually fatigued. And if you're exhausted and yet you're trying to push that 20K run, you will end up injured and it will take longer to recover. So, really listening to your body and talking with your trainer. And that's why I reckon it's a terrible term, why I think it's really good to work with someone when you're doing particularly your first marathon, so that you can say, hey, what do you think? I'm feeling like this, what do you think? And get some advice.
Yeah, I totally agree. I think it's like anything in life. You have a coach for different areas, and if it's really important to you, then you need to surround yourself with good people and support people, friends, physios, chiros, whoever helps you get to your finishing line. One thing I just want to also touch on is the calf and the Achilles.
Oh, yes, yep.
And it always comes back to these glutes, and I know the band training can be really helpful in that too. But the Achilles and the calf is a sort of common injury.
So, absolutely. The calf and the Achilles both are. If we think about, as I just said, it's all about too much, too hard, too soon, particularly with the calf, with the Achilles and the foot. With those structures, there could be a local problem, or again, it could be that the glutes aren't working well enough. So come back to my friend, the glutes. Your glutes are your powerhouse. They're the muscles that really push you along. If they're not working so well, then another muscle needs to come in. And it might be your hamstrings, it might be your calf, it might even be the little muscles in your feet trying to work too hard. So a full assessment is really important. Mm-hmm. With the calf and the feet, as we get older, as we all know, we get stiffer, and the feet in particular.
Not floppy.
Other parts get floppy. Some parts get floppy, some parts get stiffer. Yeah. The feet, the feet tend to get stiffer, and we don't tend to move quite as nicely through our feet. So when you run, you should, and again, we could come into a debate about forefoot and heel and rear foot striking, but for the most part, people will, when they're running, they'll land on the outside of their heel, then they'll roll really nicely through their foot and then push off through their big toe for the most part. As we get older, that gets a bit clunky, and it might be that we roll too early, or we don't roll enough, or our whole foot's a plank, and that makes the muscles of the foot and ankle work differently, and can overload it and cause particularly things like plantar fascia. The Achilles, and also can cause problem in the Achilles region. There's often a thought that everything in the Achilles area is Achilles, or tendonitis we used to say, but tendinopathy. It's not always. It's another thing that's very, very common, and particularly in our beginner runners or in our slightly older runners, is a thing called tibialis posterior tendinopathy, or tib post tendinopathy. And it's caused because when we're running, rather than striking through our heel, so we're running along, we strike through our outside of our heel, roll really nicely, push off our big toe and keep going. What we tend to do is, because we're stiff through our foot, we're a bit weak through our glutes, we tend to run, and rather coming down this way, we come down that way.
And
so
going the other way.
And if you run behind some people, particularly with women, but it can be with men, and if you watch, and they tend to be running on the insides of their feet a bit, or they're flicking their heels out.
Those flicks.
They're flicks, and that tends to cause this tib post problem, or one of the major causes. It's really debilitating. I've had it.
Yes.
I've had it a couple of times now. And so what we want to try and do with that is get that technique running, that technique back, which is that coming up, starting from the heel and then coming up through the big toe, right?
Yep.
So the way we can do that is just doing a calf raise, right? Just a normal calf raise. But rather than just standing up, so if you just get you to stand up again.
Yep.
So rather than just coming up onto your toes and not thinking, just up and down, if you just come up and sort of let your ankles flick out a little bit, I'm not sure where I get video of that. Are we, Rory, maybe? So the way Anna's going at the moment, she's flicking her ankles out a little bit, okay? And that's using her tibialis posterior muscles, which are not designed for running. They're designed to help everything, but they're not designed to be the main muscle for running. So what we can start to do is work on, usually holding on, just going even weight heels to toes, and then lift your heels up and ever so slightly, very, very small movement, and just take the heels off and really focus on not letting the ankles flick out. So in the clinic, we'll actually draw a line down people's Achilles.
Yes.
And the idea is they have to keep the line straight and not let it bend.
Yes.
And even if they can only get up the smallest amount, and then they come back down again.
Yep.
And so it's not much, but it's trying to retrain that brain that this is how we move forward. This is how we move forward.
So do you concentrate on the big toes then?
Yeah, so concentrate on the big toe. So as you're coming up, the weight goes through that big toe, and just pause it, push down that big toe, then lower back down again. Yeah.
Oh, that's good.
Okay. And again,
that's a really easy exercise
to do. It's a very easy exercise to do. So it's quite a nice one. And we often do calf raises, or people will do calf raises, and they will rush them. You know, oh, yes, I can go right up there. Oh, yes. And it's not really using your muscles. You're kind of just flicking through them, using momentum. Whereas we want to get these calf muscles lovely and strong. So really focusing on coming up really slowly, even if you can't come up very high, but it's really controlled, and then come back down again.
And really that's like for any exercise. You know, I can see people rush through push-ups, squats, you know, but if people really concentrate and try and get their chest on the ground, or like you did with me, you know, try and get your bottom right down and concentrate on the actual area.
Yeah, and you get them stronger. And building muscle bulk is what it's all about. That gives you strength, and that will support your joints, but it'll with practice make you faster.
And also bone density will get better as well, right? And that's
and long-term health, which is what we're after. Yeah.
Oh, that's fantastic. So the last thing that I just wanted to ask you about, Core Physio, is about the core.
Yep.
Can you tell me what you think about sit-ups and core, and the best way to increase your strength?
2 decades ago, when Pilates was huge, Pilates was just coming in.
Yes.
And before that there was planking.
Yes.
Just plank.
Yes.
And then it was Pilates. Before that, it was suck your tummy in. Each decade, we tend to build on ourselves, thankfully, and our evidence gets better and better.
Yes.
And what we've been able to show is there is no abdominal exercise that's bad.
Right.
So that's our big thing.
Oh, that's a good plus.
There's no abdominal exercise that's bad. unless it's too much for you.
Yes.
Right?
Yes.
So we've all seen people doing planks and they're holding their breath, and they're holding their breath, or they're dropping down through their pelvis or hunching up through their shoulders. Again, it's not going to achieve what they're after,
No.
and they're putting a lot of tension through their body, and potentially will cause an injury. Again, sit-ups. We've seen plenty of people doing silly
the
sit-ups.
hands to get up.
and
legs.
And you go, well, you're going to hurt yourself.
Yes.
Don't do that. And similarly, the Pilates, some of the fitness Pilates studios, there's some things being done, but it doesn't make that exercise wrong.
No.
So it's, again, working the tummy muscles well.
Yes.
And if you like to do planks, great, but do them well.
Yes.
If you like to do sit-ups, so be it. You want to do Pilates, fine.
Yes. So what's a good sit-up? What would you say?
Well, okay, let's go again.
Yes.
We got room here, yes?
Yep. Oh, I think so. Come down here. Can I do that, Rory? I'm just going to come here. Okay.
Can I do that?
Yep.
Okay, so if we're doing a sit-up, if we're particularly talking with women in particular, one of the big things we'll set up very much like this, where we've got legs, feet, knees, hips all in alignment.
Yes.
Trunk is on the ground. We're really being careful not to flare the ribs. So the back ribs, they're not locked on the ground, but they're a bit closer to the ground. So really focusing on that part being close to the ground. You're not, again, some of the old thoughts of you have to imprint your trunk into the ground.
Back flat sort of
Yeah.
thing.
Not so keen on that, but for some people you might need to, maybe they're a bit too archy, so you might need to bring them down a little bit.
Sure.
You can have your hands wherever you darn well please. They could be behind your head, they could be here, they could be here, whatever you like. As long as what you're doing is you're using your tummy muscles. And with a sit-up or a crunch or whatever it is, you're aiming to get these muscles here shorter. So the sternum to the pubic bone, you're trying to get that shorter. So if you perhaps put your hands on your legs, now if you just lift your head and shoulders up, and then and then your shoulders up, and then you curl, right? So that's not too bad. If you come back down again, try again though, and don't let your hips move at all. So they're not allowed to rock back the other way. So you keep your hips still, and now come up. So you bring your top of your body over, and then roll back down again. So that's fine. Now, as you come up and go down, let's make sure you're not holding your breath at all. So you can breathe in or breathe out, and there's different descriptions of why you should do either.
Yeah.
Most important is don't hold your breath.
Yeah.
If you are a mum who perhaps has a little bit of a weak tummy, you might be cued to gently draw your tummy in ever so slightly, as if you're putting on a pair of pants that are a bit tight. And that will just tension your lower tummy muscles. So you do that first and then lift up.
Yeah.
So there's lots of variations. Or if you've got a pelvic floor problem, we might cue pelvic floor comes on, and then you lift up.
Yes.
So there's lots of variations, but the most important thing, I think, with the sit-up is that you do it really slowly and you know what you're doing, which is you're shortening these tummy muscles.
People doing this.
Yeah, or the legs coming off, or locking it.
Or using that.
Don't lock your feet under a table, okay? All you can do is strengthen your hip flexors.
Right.
So, which for high level fitness is fine, because those people are already probably strong. But if you're weak, that's
not going to grow.
It's not going to help.
Yeah, it's like anything. You've got to stage it, don't you, with abs and things. Beck, that has been so interesting and informative. It's been fantastic to have you in. Thank you for sharing that information with us.
Pleasure.
Is there anything else that you want to say?
No, only that running is great, and there's this whole, thankfully it's shifting, but there's this whole belief out there that you're too old, you are too fat, you're too slow, haven't got enough time, couldn't possibly run. Bad knees, bad back. It's not true. Anyone can run, and it's such a simple way to exercise. It's a life skill. You start to get involved in community groups. You get to see places that you'd never see otherwise.
Great Wall of China,
other places. So anyone can do it. You just need a little bit of help to get started, I think, and that's what we do.
Yeah, that's fantastic. Thank you so much. It's very informative for all of my people and for me. So thank you for coming in today. That's great.
You're welcome.
Thanks for watching. If you want more, go to annaliptak.com.